Hello, dear aspirants. Welcome you all to Master Nursing classes. So, good evening, everyone. Good evening. So, very good evening, dear. Yes, very good evening. So, welcome you all to Master Nursing classes. Students, as all of you know that we are already halfway to cover the very important and highly topics. In the last 7 to 8 sessions, we have dealt those very important questions with update knowledge. Okay, so that may strikes in our upcoming exams. Okay, so in the today session also you will be seeing the those very important and high yield questions that may strikes in our exams with same options. Okay, students, yes, good evening. Welcome everyone to Master Nursing classes. Yes, how to join Telegram group? Telegram group link is there in the description box there. So and in comment box also at the end of the video I will give you a Telegram group link, so you can join by using that one. Okay. Yes, it is necessary to join my Telegram group. Why? Because we are like putting the daily basis questions on the Telegram group. That is very important questions, updated questions. So we are giving there. Okay. So and we are giving the those questions which may create the confusion. Okay. So that kind of the questions like will be there in our Telegram group. After answering for that question, so you will be knowing the correct answer, and that same question will come in your exams. Okay. So at yes, so purposefully, like I will share the those kinds of type of the questions which may create the confusion for you all. Okay, because you have to do the mistakes here only in the practice. Okay, so make a mistake whatever what you want to do in the practice only. Okay, so for while going to the main exams you should be having the clear content and concept in your mind. Okay, so this will be the perfect answer for these questions. Okay, so that kind of the training we are giving in the Master Nursing classes. Yes, so the link is there in the description box to join the Telegram group. Already 900 in like members are already there in the Telegram group. Okay, so you can also join the group. Yes, so without wasting the time we will start the today's class. Students, here is the first question in front of you all. Okay, read the question carefully, perfectly, then try to give your best answer for the question. Okay, yes, what is the question here? Question is very simple. That is the which imaginary modality is contraindicated. Okay, contraindicated in the pregnancy unless absolutely necessary due to the risk of the ionizing radiation. Students, among given these four options, which of the following radiation modality, radiological image modality is contraindicated in the pregnancy? Yes. So which one is contraindicated in the pregnancy? So the question is asking very simple. So among given following options, which is contraindicated in the pregnancy? So MRI is, yes, is that MRI is contraindicated? No, students. MRI is absolutely safe in the pregnancy. Okay, MRI is absolutely safe in the pregnancy. Ultrasound, safest investigation in pregnancy is the ultrasound. Okay, so we can say investigation of choice you have to prefer in pregnancy means that is the ultrasound. Okay, yes, very importantly we will dealing all those possible questions from the ultrasound, TPA scan, registration scan. Yes, so everything we will be seeing here. So yes, this is also safest. Then comes to the option D, option C, that is the X-ray. X-ray is absolutely contraindicated in the pregnancy, students. Yes, all of you have given the correct answer. That is the X-ray. X-ray is the absolutely contraindicated in the pregnancy. Even if you want to use the X-ray means you have to take a very high yield precautions, but it is absolute contraindication only in the rare cases. If the benefit is more than the like damage, then only we can use the X-ray. Otherwise, the X-ray is absolutely contraindicated in the pregnancy. Clear, students? And Doppler ultrasound again, it's the USG modality. So this is also safest in the pregnancy. Okay, so this is also safest in the pregnancy. So if the examiner asking the question which is the investigation of choice in the pregnancy, that is the ultrasound is the investigation of choice to detect the pregnancy. Students, very importantly, yes, you have to know that. So in the pregnancy, so the very important investigation is the ultrasound. So we have discussed the one sign on ultrasound, so previous videos. Okay, hope everyone know that one. Okay, here also I will discuss once again because it is important. Students, this is the uterus, so this is the cervix, and this is the vagina. Okay, so whenever the implantation occurs, the true gestational sac, okay, means the correct implantation, that indicating the true gestational sac. Okay, so always implantation occurs at the periphery, means it is eccentric. Normally implantation occurs eccentric. Okay, means one side of the uterus. So in this particular time, there is enlargement of the uterus one side. This is the normally. Okay, so we can say that is the asymmetrical enlargement of the uterus. Asymmetrical enlargement of uterus. Okay, what we can say the asymmetrical enlargement of the uterus in the pregnancy. Okay, so this side of the uterus is normal like this, and the implantation side is like it will be seen enlarged. Okay, it will be seen somewhat large. Okay, so it is enlarging both side means that is a symmetrical. Okay, so it is enlarging only one side, so that is the asymmetrical enlargement of the uterus because of the eccentric means one side implantation. So this is also normal. Okay, what we call this sign? Yes, very nice. Okay, so that is what we call the Piscaki sign. What we call this one as a, yes, this is called as a Piscaki sign. Okay, so this is very very important. Okay, yes, sign students, during the time of the implantation the bleeding will happen. So what we call this one? During the time of the implantation the bleeding will happen. So what we call this one? Yes, already we have discussed in the last video. Yes, very nice of you all. Okay, so that is the Hartmann sign. Okay, what we call that one as in the Hartmann sign. Yes, so this Piscaki sign and Hartmann sign they can ask in the exams. Very very important. Okay, so normally how our implantation occurs? Implantation occurs one side, that is the unilateral. Okay, that is also called as the eccentric. Okay, yes, that is the sign of the true gestational sac. If in case the implantation looks like in middle, so this is called as a pseudo gestational sac. Okay, this is what we call as in the pseudo means it is a false gestational sac. Okay, false gestational sac. So it indicating the, yes, the ectopic pregnancy means the actual implantation will be here. So the shadow of this implantation will be coming here. Okay, so actual implantation will be in the fallopian tube, and the shadow of this one looks like here in the center. Okay, so in the USG you are getting the implantation at the middle of the uterus, that is called as indication the pseudo gestational sac. It indicates the ectopic pregnancy. Okay, it indicating the ectopic pregnancy. Then what is the ectopic pregnancy? Ectopic pregnancy is normally, yes, normally implantation should occur here in middle of the, sorry, in the uterine cavity. Okay, so normally implantation should occur in the uterine cavity. If the implantation occurring other than the uterine cavity, so that is called as the implantation. That is called the ectopic pregnancy. The most common site of the ectopic pregnancy is the fallopian tube. Okay, so here also if you want to know the best answer in the fallopian tube, that is the ample of the fallopian tube. Okay, that is the ample of the fallopian tube. So these questions repeatedly asked in our exams. Okay, students, so MRI is the safe in pregnancy, but contrast MRI is contraindicated in pregnancy. Okay, MRI with contrast is contraindicated in pregnancy. Okay, MRI is safe in pregnancy. MRI with contrast is contraindicated in pregnancy. Any investigations where you are using the contrast, that investigation is contraindicated in the pregnancy. Okay, so you have to identify the investigations where we are using the contrast. Okay, so then you have to eliminate the options. Clear, students? So few of the examples I will give. Yes, the contraindicated investigations in the pregnancy, that is the, yes, contrast MRI is contraindicated. Contrast MRI is contraindicated. Then, yes, that is the intravenous pylography. So this one is the, yes, again we are injecting the contrast in the vein. Okay, so while this contrast come to the kidney, okay, pylorus of the kidney, so we'll take the X-ray of this one. Okay, so that is the intravenous pylography. Again it is contraindicated. So this is the investigation done in the visualization of the kidneys, that is the intravenous pylography with the help of the contrast. Okay, this is also absolutely contraindicated in pregnancy. CT scan, whether it is a plain CT or it is a contrast induced CT, it is completely contraindicated in the pregnancy. Okay, CT scan is completely contraindicated in the pregnancy, students, remember. Okay, so then comes to the which one? Okay, all contrast imaginary. So mainly this they will ask, that is the contrast MRI is contraindicated in intravenous pylography is contraindicated, CT scan is contraindicated. Okay, so then again, which is, can anyone able to tell what all of the other investigations come which is contraindicated? Yes, that is the MRCP is also contraindicated. Okay, what is MRCP? That is the magnetic resonance cholangiopancreatography. Okay, MRCP is also contraindicated. ERCP we can use, that is the endoscopic, yes, retrograde cholangiopancreatography. So this one, it is not safe, but we can use if necessary only. We can use if necessary only, that is the ERCP, but MRCP is absolutely contraindicated. Clear bacho? Clear. Okay, so this is the very basic you have to know. Okay, so but the only one questions they will ask from here is the there is chance of the CT scan. Okay, so CT scan is contraindicated in pregnancy, absolutely contraindicated. And yes, the yes, very nice, very nice, that is the X-ray is absolutely contraindicated in the pregnancy. Okay, X-ray is absolutely contraindicated in the pregnancy. It is very, very basic. You have to know. Okay, so here is the next question, students. I hope you all got the answer for this one. Ultrasound is the safest in the pregnancy. Yes. Then answer for this one is that is the X-ray. Okay, so that is the contraindicated in pregnancy. Why? Because in the questions they have asked contraindicated ionizing radiation. Okay, so that is the imaginary modality, that is the X-ray, which is absolutely contraindicated. Hope the concept is clear for this one. Yes, yes, very nice of you all. Okay, so here is the next question. Yes, good evening, dear. Welcome, welcome. Yes, you are late today. Yes, so here is the class. Yes, here is the next question. So that is the at what gestational age is ultrasound most commonly used for screening in pregnancy? So okay, so what is the exactly gestational age? So here, okay, at what exact gestational age we are using the USG for screening of the pregnancy? Okay, students, the initial scanning will be started. The yes, can you able to answer for this one? Yes, very nice, very nice. Come on. So who all are live to the session? So do comment in the comment box. So what is the exact exact gestational age where we are using the USG? Okay, for screening of the pregnancy. So the question is not asking for the yes to target the anomaly. Okay, so the question, yes, the first I will eliminate the options which is creating confusion for you. So if the examiner asking, there is the targeted, yes, imagine for fetal anomaly. That is the TIPA scan if the examiner asking, or the anomaly scan the examiner asking, means your answer would be 18 to 20. But here just they are asking the screening in the pregnancy. So at what age we have to do this USG for the screening of the pregnancy? Okay, yes, the screening of the pregnancy, the best time to do the USG is the 10 to 12 weeks. Okay, almost all of you have given the correct answer. Yes, so that is the correct answer. Clear, students? So this the screening of the pregnancy are the 10 to 12 weeks. So this one we call as in the registration scheme. Okay, what we call this one as in the registration. Okay, what we call this one is the registration scan. Okay, so in this registration scan we are just focusing over the gestational age of the baby. Okay, we can tell the expected date of the delivery by using this registration scan. Okay, so we are just assessing the fetal cardiac movement. Okay, so and only two anomalies we can assess here. There's the cardiovascular anomalies. Okay, and main important is that is the yes, the central nervous system anomaly, that is the spina bifida, we can detect yes at the 10 to 12 week of the pregnancy only. Okay, so no need to wait till the TIFA. No need to wait till the TIFA. Central nervous system anomaly and CV anomaly we can detect easily at the 10 to 12 weeks. Okay, mainly there is the anencephaly. It is detected at the 10 week of the pregnancy only. Okay, at the 10 week of the pregnancy only we can detect the yes, that is the anencephaly. Okay, no need to wait till the TIFA because it is central nervous system. Okay, so it will grow just before the 8 week only. Okay, so this basic concept you have to keep in your mind. Okay, so let me take a new slide for best understanding. Okay, so consider, so this is our complete gestation. Okay, this is the first trimester, this is the second trimester, this is the third trimester. Okay, so if the examiner asking the question, okay, what is the best time to for the organogenesis, means the best time for organogenesis is from the 8 weeks to 20 weeks. So when complete organogenesis occurs at the 20 week of the gestation, complete organogenesis occurs in this period. Okay, so it is between the first and second trimester. But two system, that is the cardiovascular system and central nervous system. These both system, yes, it will grow before 8 weeks only. It will go before 8 week only. The central nervous system and cardiac system, it will grow yes before 8 week only. So because of that, in the registration scan, okay, from 10 to 12 weeks only, okay, we can identify in the registration scan from the 10 to 12 week only, so we can identify whether there is any abnormalities in the central nervous system or whether there is any abnormality in the CVS. So okay, so and other investigations, that is for the TPA scan, we are doing at the time of the 18 to 20 week. Okay, 18 to 20 week is the best time to do the TPA scan. Okay, so what is the TPA scan? Targeted imaging for fetal anomaly. Okay, clarity bachcho? Yes, very nice of you all. Okay, this is the very basic you have to understand regarding the TPA scan. TPA scan is also called as the anomaly scan. Okay, so in the pregnancy, okay, some peoples are very poor, so they will take, we won't take the USG every like trimester, and we can't come for every antenatal visit. So for those people, if you want to advise only one scan, so you have to advise the TPA scan. Okay, because it is very important. We are doing the TPA scan at the 18 to 20 weeks, so at that particular time period all organogenesis will be there, so we can easily target the each and every organ. Okay, we can easily assess the all anomalies possible in the intrauterine life. Clear to students? Yes, very nice of you all. Okay, so the answer for the question is the yes, 10 to 12 week we can use the yes USG as a screening modality of the pregnancy. Students, clear? Yes, very nice of you all. Okay, so 18 to 20 week is the best time to do the TPA scan. Okay, so clear, I hope so. Okay, so here is the next question. Yes, read the question carefully. So the today's class will be slow because some students they have commented like, so I will teach very fast, sir. So that's what I kept the yes, the content very slow and perfect today. Okay, so if you have any doubt, so you can discuss in the comment box. Okay, which of the following is a condition is caused by the trisomy 18? So okay, so this is very basic questions they can ask in the RRB, but the next questions in the Norcet on this particular concept I will teach you here only on this particular yes, on this particular question. Okay, yes, which of the following condition is caused by the trisomy 18? Yes, option A is telling that the Turner syndrome, option B is telling that the yes, Edwards syndrome, C is telling that the Down syndrome, then D is telling that it is a Patau syndrome. Yes, let me uh, clarify you all. Okay, so before that, yes, so I'm waiting for your answer in the comment box. Okay, do comment for this one. Yes, which of the following condition is caused by the trisomy 18? Yes, very nice of you all. Very nice of you all. This kind of the involvement I want actually. Okay, that is the 18 means that is the Edward syndrome. Okay, so trisomy 21 means which one? So do comment for the trisomy 21. Yes, what is the name of the trisomy 21? Very nice of you all. Okay, trisomy 21 means that is the Down syndrome. Okay, trisomy 21 is your Down syndrome. Then what about the Patau syndrome? Yes, very nice of you all. Okay, already one student already commented related to Patau syndrome also. Very nice of you. Okay, so that is the trisomy 13. Okay, so trisomy 13 is the Patau syndrome. Trisomy 21 is the Down syndrome. Okay, trisomy 18 is the Edward syndrome. Okay, so now I will paste the image in front of you. Okay, yes, so you have to identify. So this particular image is related to which syndrome? Okay, here is the image. Okay, so this will comes in your Norcet as a IBQ. Okay, as a image based question. Okay, yes, so do identify the syndrome in the given image. Yes, students, already there is a highlight. Yes, very nice of you all. Okay, that is the trisomy 21. Okay, look at the first pair, only two pair are there, it's normal. Two pair normal. Okay, all are normal. Okay, because all are having the two pairs, but when it comes to the 21st pair, so there is the three pair. Okay, sorry, not three pair, there are total three chromosomes means okay, one pair plus one extra chromosome. This is what we call as the trisomy. What we call this one as in the tri means three. Okay, so there is the zomy, trisomy. So okay, this one what we call as in the yes, very nice, very nice. Okay, so this one what we call as in the Down syndrome. Trisomy 21 is the Down syndrome. Clarity, bachcho? Yes, it is the very, very and very important you have to identify. So in the same image, they can give yes the extra chromosome at the 13th. Okay, here. So if he is giving the 13 extra chromosome here, there is the trisomy 13. That is the Patau syndrome. Okay, that is the Patau syndrome. If in case he is giving the extra chromosome here at the 18. Okay, so here at the 18 he is giving means that is the that indicating yes, that is the Edward syndrome. Edward syndrome. Okay, so this is the, okay, so very easy and important topic. But now my next question is the what it picture. So when it this picture comes, okay, so when this picture comes means we have to take a sample from the fetus. Okay, we have to give for the karyotyping. This investigation is called as the karyotyping. Okay, this investigation is called as the karyo, okay, typing. So already you people have studied already in your PUC only. Okay, this is what we call as the karyotyping. Karyotyping is the, yes, investigation method where we are taking the photo of the chromosomes. That is called as the karyotyping. Very important. Okay, so investigation of choice are the definitive test for the Down syndrome or Patau syndrome, or we can say the Edward syndrome. The final investigation or the investigation of choice or the definitive investigation is the, that is the very importantly karyotyping. It will be your answer. Okay, students, clear? Okay, so here is the next question. You have to study this one. Okay, that is the very basic and important question. Okay, the question it is telling that I hope the answer is clear for everyone. Yes, very nice of you. Okay, so here is the next question. Okay, so what does the double test? What does the double test for the Down syndrome in the screening measures? So what it indicating, the double test in the Down syndrome? Yes, students, what it indicates the double test in the Down syndrome? Yes, option A, there is the alpha fetoprotein and inhibin. Option B is the free beta HCG and pregnancy associated plasma protein A, that is the PAPA. So then the free beta HCG and the alpha fetoprotein, then the papa and estrol. So what is the double test indicates? Okay, double test indicates here we are assessing the maternal blood two hormones. Okay, so two hormones, it indicates in the two hormones that indicating the helpful for the screening of the Down syndrome. Okay, what is the two hormones we have to assess in the double test? Okay, that helps for the screening of the Down syndrome. Okay, yes, can anyone able to tell the answer? Very nice of you all. Okay, that is the option B is the correct answer. That is the free beta human chorionic gonadotropin, or you can say the beta HCG and pregnancy associated plasma protein are the two hormones. Yes, we are basically using to screen the Down syndrome. Students, it is very important to know that the screening of the Down syndrome. Okay, the screening of the Down syndrome. Why? My question is why. So, why? Because if the baby born to a mother with Down syndrome, it is mentally retarded. Okay, so it is a mentally retarded baby and it is completely physically challenged baby. Okay, so then in that condition, it is completely dependent on the family. Okay, so that is what it is, early identification of the Down syndrome and termination of the pregnancy if in case of the mentally retarded or the Down syndrome baby means, so that is helpful for to reducing the burden on that particular family. So because of that, for every woman who is getting the pregnant, it is very important and necessary to screen for the Down syndrome. Okay, I am talking the screening of the Down syndrome. Okay, so in the Down syndrome screening I am talking. Okay, so there are modality to screen the Down syndrome. I will tell definitely one fixed multiple choice questions will come from this concept what I am teaching here now. Okay, so that is the Down syndrome screening. In the Down syndrome screening, so if in case the mother comes in the first trimester, if the mother comes in the first trimester, okay, so we are having the two modalities here. One is blood test, one is the blood test, another one is the ultrasonography. Okay, so in the first trimester, if the mother comes means one is having the blood test, another is the ultrasonography. In the blood test we are doing the double test. Okay, so in the blood test we are doing the double test. So this double test indicating the, yes, assessing for the two hormones, that is the free beta HCG. Okay, one more is the pregnancy associated plasma protein A2. Okay, so we can say A1. Okay, so not A1, that is the A2. Okay, that's, let me write it clearly. Let me write clearly here, otherwise you people will get confused. Okay, so there is the pregnancy associated plasma protein A2. Okay, so these very important hormones we have to assess here. Okay, so there is the beta HCG and papa. Okay, very importantly, then what we have to see in the ultrasonography, we have to see in the ultrasonography, there is the for the knuckle translucency, what you have to see in the ultrasonography, in the USG we have to see the knuckle translucency. What is knuckle translucency? Knuckle translucency is the fluid filled cavity, so beneath the neck of the fetus. This is called as the knuckle translucency. Okay, so are you people able to see this one? Okay, this red highlighted area, that is the fluid filled cavity just before the fetal or just beneath the fetal head, that is called as the knuckle translucency. If in case this knuckle translucency is more than 3 mm, if in case this knuckle translucency is more than 3 mm, okay, you have to assess for the three condition. You have to assess for the three condition. One is Down syndrome, another one is Turner syndrome, another one is cardiovascular, yes, problems. Okay, cardiovascular system problems. So in the Down syndrome and like Turner syndrome, so we can do the, yes, the karyotyping for confirming this one. Okay, so if in case in the screening modality, this is the complete screening modality what I thought here. So that is the blood investigation, blood test, that is the double test. In the double test we are checking the beta hcg and papa. Okay, and ultrasonography, that is we are seeing for the nuchal translucency. Okay, so if in case high hcg, if in case high hcg and low papa, okay, increased hcg and decreased papa, or if in case the nuchal translucency is more than 3 mm, okay, so this indicating the positive screening. Okay, there may be a chance of the Down syndrome. Okay, there may be a chance of the Down syndrome. This is the what I told, this is the completely screening test. Okay, this is completely screening test, so we can't confirm by only screening. Okay, we can't confirm a disease by screening, so we have to go for the definitive test. So when there is a positive double test or the positive nickel translucency it will come, then we have to go for the karyotyping. Then we have to go for the karyotyping. Then the karyotyping is the, yes, the karyotyping is the, yes, the karyotyping is the diagnostic of choice or investigation of choice or confirmatory test, we can say. Okay, confirmatory test for the Down syndrome. Clarity, bachcho? Clarity? Yes, very, very importantly, you have to know related to the screening of the Down syndrome. Okay, so this is what I thought here. It is only in the first trimester. Okay, so let me discuss the next question that indicating the everything related to the second trimester. Okay, read this particular question. Okay, then try to give the answer here. Okay, clear? Yes. So what does the triple test for the Down syndrome typically measures in the maternal serum? Okay, so in the mother serum or in the mother blood, what you people have to measure in the triple test of the Down syndrome screening. Okay, so again you are screening for the Down syndrome. Okay, so again you are screening for the Down syndrome. That is a triple test in the maternal serum. Students, again here we are having the two tests. Okay, for if the mother come in the second trimester. Okay, if her mother coming in the second trimester, so again we are having the two test here, that is the very, very importantly blood test and ultrasonography. Okay, again blood test and ultrasonography. Bachcho, it is very, very important. In the second trimester we have to do the blood test as a triple test or the quadruple test. Okay, triple test, or we can say the quadruple test. Okay, and in the ultrasonography we have to look for the, yes, the length of the humerus bone length. Okay, so then the length of the femur, the length of the femur bone. Okay, repeat again, the length of the humerus, the length of the femur bone, then the length of the, yes, repeat with me, yes, the length of the humerus, length of the femur, then the options of the nasal bone. Okay, options of the nasal bone, yes, then whatever, what else we have to see, there is the neck, or we can say knuckle skin fold thickness. Very, very important, that is the knuckle skin fold thickness. Okay, so these very important four measures we have to see in the second trimester. Okay, we have to see in the second trimester, that is the length of the humerus bone, length of the femur bone, options of the nasal bone, and the knuckle skin fold thickness. Okay, so if the length of the humerus is short or length of the femur is short, nasal bone is absent, and skin fold thickness is yes more. So these all situations which are indicating the again the Down syndrome. Okay, so again it indicating the Down syndrome. In the triple test, what we have to assess? We have to assess the three hormones. We have to assess the three hormone. What are those three hormone we have to identify here? Okay, yes. So what are those three hormone we have to identify here? So option A is that alpha fetoprotein and free beta HCG and estriol. Option B is telling that alpha fetoprotein, then beta HCG, then inhibin A. Then option D is telling that there's the alpha fetoprotein, estradiol, inhibin A, and HCG. Students, here we are checking the four. Okay, so this is not a triple test. This is a quadruple test. Okay, this is the quadruple test. Why? Because here we are checking the four hormone alpha fetoprotein, estradiol, inhibin, and HCG. Okay, so this is also done in the second trimester. Okay, so here we are checking the four components. That is the quadruple test. Okay, this is not a triple test. This is the quadruple test. Okay, so then what about the triple test? Why? Because in question they have asked a triple test. Yes, in the triple test we have to note and mention the alpha fetoprotein, then HCG, then estradiol. Okay, so how we have to remember this one? We have to remember this one. There's the home and emotion. Okay, home and emotion. Home means here the HCG, A means there is the alpha fetoprotein, E means there is the estradiol. Okay, so this is the HCG. Repeat with me: HCG, alpha fetoprotein, then is triol. Okay, so that is we can say the estrogen number 3. Clarity bachcho. So in the triple test we have to assess the yes option A, that is the alpha fetoprotein, then beta HCG, then estradiol. This is the correct answer. Okay, this is the 10-star questions or most important questions for your upcoming Norcet 8 exams. Okay, so for your upcoming Norcet 8 exams and RRB also there may be chance, but for Norcet 8 exams it is fixed. You consider it is fixed. Okay, clarity bachcho. Yes, very very important. Yes, so we have studied the screening of the Down syndrome in the first trimester. Yes, we are doing the blood test and yes, in the first trimester, we are doing the blood test and ultrasonography. In the first trimester, in the blood test, we are doing the double test. So in the double test, we are seeing the two hormones, that is the beta HCG and papa. Okay, so beta HCG and papa. Okay, so then in the ultrasonography, in the first trimester, we are screening for the yes, the knuckle translucency. If the knuckle translucency is more than 3 mm, we have to assess again for the three conditions. That is the one is Down syndrome, one is Turner syndrome. Then yes, another one is very very importantly yes cardiac anomalies. Okay, so that is the again the knuckle translucency more than 3 mm indicating the Down syndrome. So this is the screening test. Okay, so if the positive screening test, then we have to go for the confirmatory test for the Down syndrome. Confirmatory test for the Down syndrome is the karyotyping. Okay, so if the mother she is not came in the second trimester, first trimester, she came directly to the second trimester. So then we are doing the yes, then we are doing the in the second trimester triple test. Okay, in triple test also we are doing the blood test and USG. Okay, in the blood test we are doing the triple test, then quadruple test. So in the triple test we are assessing the three hormones. That is the home and emotion. Home means H means HCG. Then A means alpha fetoprotein and yes emotion E means estradiol. Okay, that is the triple test. Then in the quadruple test, one more it includes, that is the inhibin. Okay, that is also we have seen here. That is the option C, alpha fetoprotein, estradiol, and HCG plus inhibin. So it is the quadruple test. Then so in the second trimester also ultrasonography, what we are studying, that is the length of the humerus, length of the femur, absence of the nose bone, then neck skin fold thickness. If in case the positive triple test, or we can if in case the positive ultrasonography, so then again we have to go for the confirmatory test, that is the karyotyping. Okay, so even in case of the triple test or the quadruple test, okay, so again we have to go for the yes the confirmatory test. So one thing you have to remember, to say the Down syndrome is positive. Okay, so I will give a tricks, so you have to remember the tricks, it will helps in your exams. Okay, so only these two hormones will increases in the Down syndrome. Okay, so only these two hormones it will increases in the Down syndrome. What is the hormones? That is the high H C G. Okay, so remember high HCG and increased inhibin. Okay, that is increased inhibin. So rest all pregnancy associated plasma protein A2 will get decreases, HCG will increases, okay, and inhibin will increases, okay. High HCG, increased inhibin. So these two are increasing means it indicating that is the Down syndrome, okay. So inhibin we are checking in the quadruple test, okay. So in the quadruple test and beta HCG we are checking in the, yes, the very importantly double test, triple test and quadruple test, all three the common is the HCG, but in the Down syndrome HCG will increases, okay. So yes, inhibin will increases, arrest all, that is the alpha fetoprotein. What happens the alpha fetoprotein in the Down syndrome? Alpha fetoprotein in the Down syndrome what happens? Decreases, it indicating the Down syndrome, okay. So then decreased pregnancy associated plasma protein A2, okay. So this is also get decreases, okay, again in the Down syndrome. Yes, papa will decreases, alpha fetoprotein will decreases, okay. So then one more, which hormone? That is the, yes, estradiol, okay. So estradiol also it will get decreases, okay. That is the E3, that is the estradiol also it will get decreases. Clear bachcho? Clear. Very very importantly, in the Down syndrome only two hormone will increases, that is the, yes, high HCG and increased inhibin. Rest all will get decreases. In case of decreased alpha fetoprotein, in case of the decreased papa, in case of the decreased estradiol, this is also indicating the Down syndrome screening positive. And high HCG and increased inhibin, this is also indicating the Down syndrome is screening positive. So if the positive screening of the Down syndrome if you found means we have to go for the confirmatory test, that is the karyotyping. So we have studied a lot of things repeatedly, okay. It is very much helpful for you all, okay. So my next question is for doing the karyotyping we need a sample, okay. We need the sample, as I told, yes. For the screening purpose we took the mother blood and we done the blood test, okay. So externally we have done the ECG, USG, okay. Externally we have monitored, but to confirm we need the karyotyping, okay. Karyotyping means we need the cell from the fetus, okay. So at that point of the time we are having the three options. That is the one, we have to take the cells from the amniotic fluid, so by amniocentesis, okay. Means amniocentesis means taking the amniotic fluid out of the amniotic cavity for investigation and treatment purpose, that is what we call as the amniocentesis. Clear? So another method is the from the placenta, from the villi of the placenta we are taking the sample, that is what we call the chorionic villi sampling, okay. So yes, from the villi of the sample we are taking the placenta, we are taking the sample, that is called as the chorionic villi sampling. Another one is the from directly pricking in the umbilical cord with the USC guidance, directly pricking in the umbilical cord we can take the umbilical cord blood. So that is what called as the cardosynthesis. Three words it will comes in front of you students, okay. So yes, for the confirmatory test for the karyotyping, okay. For the karyotyping we need the sample, okay. We need the sample. So okay, this samples will be collected by the three methods, okay. These samples will be collected by the three methods. So we are collecting the sample from the placenta, okay. So from the umbilical cord, okay, or from the amniotic cavity, okay. From the amniotic fluid, okay, amniotic cavity. So I am taking the sample from the placental villi, so that is what we call as in the chorionic villi sampling, okay. So chorionic villi sampling is the best to take in the first trimester after the 10 week, okay. So this is the, we have to take only after the 10 week, we can't take the chorionic villi sampling before the 10 week, okay. If in case the examiner asking the best time is the 11 to 13 week is the best time, okay. So best time is the 11 to 13 week is the best time, okay. So when we can take after the 10 week, okay. So 10 after 10 week we can take the chorionic villi sampling, okay. Best time is the, yes, after the 10 to after the 11 to 12 week, okay. This is the best and this is the criteria or guideline, okay. So students, clear? So if in case I am taking the, yes, the blood from the umbilical cord, that is called as the cardo, that is the card, okay, cardosynthesis, okay. We can say cardosynthesis, okay. There is the cardosynthesis is the, we are taking the blood from the umbilical cord. So okay, if I taking the, yes, the fluid from the amniotic cavity, that is what we call as in the amniocentesis, okay. That is what we call as in the amniocentesis. Hope the concept is clear, students. in the first trimester only recommended is the chorionic villus sampling. Okay, if the female comes in the second trimester, we can do either cardosynthesis or amniocentesis. But when we are doing in the first trimester, so there is 1% chance of the fetal loss in the our what we call the chorionic villus sampling. Okay, but 1% means, yes, the we are taking the sample from the 100 female means one fetus will get loss. Okay, one fetus will get loss. But in the cardosynthesis there is 3% chance of the abortion. Okay, 3% chance of the abortion. So in the cardosynthesis we are taking the sample from the 100 female means the 3 female will get abort. Okay, the 3 female will get abort. But in the amniocentesis we are taking the sample means, so that is the very less students, 1 out of 300. Okay, so we are taking the 300 sample means only one chance of the fetal loss. So among all these, the recommended one is the amniocentesis. Okay, so amniocentesis is the best done in the, yes, the 16 to 18 week. Okay, best time of the doing the amniocentesis is the 16 to 18 week. Okay, so best time to do the chorionic villus sampling is the 11 to 13 week. Okay, average time we can say from the 12 to 13 week also. Clarity bachcho, clarity. Okay, so in the second trimester, as I told, cardosynthesis also we can do, or amniocentesis also we can do. But as compared to the amniocentesis, cardosynthesis having the highest fetal loss, okay, incidence means there is highest chance of the abortions in the cardosynthesis. Okay, so because of that the preferred one is the amniocentesis. Clear bachcho? So the question will ask in the exam, the best time to do the amniocentesis is the 16 to 18 week. The best time to do the cardosynthesis is the again 16 to 18 week. The best time to do the chorionic villus sampling is the 11 to 13 week. And yes, the when we can start to do the chorionic villus sampling after the 10 week. Okay, बच्चों very important, if in case by mistakenly you are taking the sample from the umbilical cord, sorry, you are taking the sample from the placenta. Okay, so before the 10 weeks, okay, before the 10 weeks you are taking the sample from the placenta. Okay, that is what you call the taking the sample from the placenta. That is the chorionic villus sampling. Chorionic villus sampling, if you are taking less than 10 weeks means there is chance of the, yes, the oro mandibular fetal defect. If you are taking the sample before the 10 week means, yes, the chance of the formation of the fetus without oro and oral cavity and mandibular. Okay, or we can say the malformed oral cavity and malformed the mandible will develop if you are try to take the sample from the placenta. That is the chorionic villus sampling before 10 weeks you are doing means that will causes the oromandibular defect. Okay, this is the very important and most important you have to remember. Okay, clear bachcho? Clear? Okay, yes. So the question is like, the chorionic villus sampling is typically performed at which stage of the pregnancy? Now tell me the answer. Yes, very nice of you all. That is the, yes, very good. So chorionic villus sampling, yes, the taking the sample from the placenta under the ultrasonography guidance. Okay, so we'll keep the USG on the mother abdomen, then we'll take a needle, we'll insert a needle. Okay, so with the help of the USG we'll see where the needle is going, just near to the, yes, the placental chorionic villi. We will take the, just aspirate the sample, so the chorionic villi cells will come, we will send that cells for the karyotyping. Okay, in the karyotyping, okay, the image will come like this, the image will come like this. Okay, in the karyotyping, yes, this image already we have seen. So in the karyotyping the image will come like this. If the extra chromosome came at the 21st means, yes, that is the, we will diagnose the baby or the fetus inside the mother womb is the, yes, positive for the Down syndrome. Okay, then we'll plan for terminating the fetus after counseling to the parents. Okay, is that clear, bachcho? Clear. Okay, so the answer for this one is the, yes, the chorionic villus sample is typically performed at the which stage of the pregnancy? That is the very importantly 10 to 13 weeks is the time to perform the chorionic villus sampling. And the best time is the, I told, 11 to 13 week is the best time. Okay, and best time to do the amniocentesis, that is the, let me write it again. Okay, best time to do the amniocentesis. Okay, this is the, what we call the 16 to 18 week. Bachon, clear? I hope everything is clear. Okay, Yes. Yes, very nice of you all. Okay, so that is the very important. So you have to remember. So the next question is here. So which period is considered the embryonic period? The very basic and most important for your RRB. Okay, most important for your RRB. Almost all you people will give the correct answer for this one. Okay, so already you people are joined with master nursing classes. This is many time discussed questions. Okay, so in the last previous videos. Okay, so what is the period it is considered as the embryonic period? So option A is telling that 0 to 2 weeks, option B is telling that 2 to 8 weeks, option C is telling that 8 to 20 weeks, then option D is telling that is the 20 to 14 weeks. So what you are giving the answer? C is not a correct answer. Yes, I will eliminate the C here first. Yes, C is not correct answer. Don't delete your answer. Okay, no problem. You are giving, at least you are trying to give the correct answer. Okay, so which period is considered as the embryonic period? Yes, very nice of you all. Very good. So that is the option B is the correct answer. 2 to 8 weeks is the considered as the embryonic period. So in the growth periods, so we are having the division from the, yes, after the fertilization of the sperm and ova. Okay, so it will produce the zygote. It will produce the zygote. So this zygote we call as in the, yes, the fertilized ova. Okay, we can also call this one as in the fertilized ova. So the period of the fertilized ova, it will start from the 0 to 2 weeks, or we can say 14 days. Okay, so the period from the 0 to 2 weeks, or the 0 to 2 weeks, or the 14 days. So this is what we call as the fertilized ovum stage. Okay, so the next one is that is the, what we call, that is in the embryonic phase. Okay, what we call this one is the embryonic phase. Okay, so in the embryonic phase, okay, it will start from 3 weeks to, yes, till 8 weeks. Okay, 2 weeks to 8 weeks. So 3 weeks to 8 weeks, that is the embryonic phase. In many books they have given the 2 weeks to 8 weeks. Okay, the final answer you have to put in your exam as a 3 weeks to 8 weeks. Okay, so this is the very important. Yes, so embryonic phase, that is the 3 weeks to 8 weeks. Okay, so then comes to the third stage, that is the, yes, which stage? Third stage, that is the fetal stage. Okay, fetal stage. Okay, fetal stage is the more than 9 week, we call this one as in the fetal stage, till the birth. Okay, till the birth. So after 9 week till the birth, we call this one as in the fetal stage. So these are the intrauterine growth periods, students. So the fetal stage starts with the, yes, more than 9 week till the birth. Okay, this is the fetal stage. Okay, so this is the growth period in the intrauterine life. What if in case the growth period after the extrauterine life? Okay, extrauterine life means after the delivery of the baby. Okay, so after the delivery of the baby, the growth periods are like this. Okay, so you have to identify only 3. Okay, and it is very important to remember only 3 and give the best answer for 3. Okay, so from birth to 28 days. So this is what you call as the neonatal period. Okay, this is what you call the neonatal period. Okay, so then 28 days, or we can say 1 month to till 1 year. So this is what you call as, what you call this one, after neonate. Yes, so then 1 year to 3 years. What you call this one? Yes, come on, comment in the comment box. What is the called? Yes, the 1 year to 3 year. What we call this one? Then 28 days to 1 year. What we call this one? Yes, already you people know that that is the correct answer. You have to comment in the comment box. Yes, correct. That is a toddler. 1 year to 3 year is the toddler. Okay, I am mentioning the correct answer here. Okay, toddler. Yes, the 1 year to three year is the toddler. Correct. So then 28 days to the 1 year. Yes. What do you call the 28 days to the 1 year? Come on, students. Very basic questions. Yes, the birth to 28 days is the neonate. It's finished already. So 28 days to the 1 year. No. 3 to 6 year is the preschooler. Okay, 3 to 6 year is the preschooler. This one is the preschooler. Yes, very nice. That is the infant period. Okay, that is the infant period. Okay, So here we have studied the fetal period. Okay, so this is the infant period. Okay, so birth to 28 days is the neonate, 28 days to the 1 year is the infant, 1 to 3 years is the toddler, 3 to 6 years is the schooler, preschooler. Okay, more than 6 year. Okay, so till 12 years we can say the schoolers. Okay, so now it will comes from the 12 to 18. Okay, so early adolescent, so that will discuss. Okay, so while discussing the pediatric, this is the basic growth developmental period we have to understand. Okay, so students sometime they will ask the questions on the neonate, what is the early neonate and what is the late neonate. Okay, so early neonate is the neonatal period from the, yes, neonatal period from the, yes, first 7 days. Okay, so that is the first 7 days, or we can say from the, yes, yes, very nice. Okay, that is the early neonatal period. Okay, after that one, the late neonatal period. Yes, clear, bacha. Okay, so this is very important. You have to understand and keep in your mind. Okay, yes, bacha, clear. Very nice. Yes. So here is the next question. Hope the concept is clear and answer is clear for this question. That is the 2 to 8 weeks is the embryonic period. Okay, here we have discussed. Okay, so one more questions will come from this one. Okay, one more question. That is the most common. Okay, most common period of the teratogenic. Most common teratogenic period. Teratogenic means, okay, teratogenic means it is simple. Okay, so this is the our beautiful placenta. Okay, something from the mother, it is coming, it is crossing the placenta and it is damaging the fetus. Means any agent, substance or object which is crossing the placenta and damaging to the fetus, this particular object, agent or material, so we call this one as the teratogen. What we call this one as the teratogen. Okay, so the effect which is coming on the fetus is called as the teratogenicity. Okay, teratogenic effect we can say. Okay, teratogenic effect. For example, consider if the mother is taking the thalidomide tablet. Okay, thalidomide medicine. Okay, so these medicines we are using in the treatment of the our multiple myeloma, or we can say the plasma cell cancer. So this thalidomide medicine, okay, it will crosses the placenta and it will damages the fetus. Okay, so it will not allow the fetal legs to grow. Okay, and hands to grow. So this is what we call as in the phacomalia. Okay, phacomalia means that is the defect in the limbs of the fetus. Okay, due to the teratogenic effect of the thalidomide medicine. Okay, so it is very important. Okay, you have to consider in your mind. Okay, there are lots of the medicines are there as a teratogenic. Okay, in the tetracycline, the bones and teeth of the baby will be defected. Okay, in the what we call the isotetronian, the medicine which all are we are using for the reducing the pimples. Okay, so many females accidentally they uses the isotetronian while during the pregnancy because to reduce the pimples. Okay, so but isotetronian is that much teratogenic, it will definitely cross the placenta, it may leads to the, yes, neural tube defect in the fetus. Okay, that is the isotetronian also contraindicated in pregnancy. Thalidomide is also contraindicated in pregnancy. There are lots of the teratogenic drugs we will discuss in the separate session. Okay, so just I am telling the basic that the teratogen means the any substance or the any component which is crossing the placenta and which is damaging to the fetus, that is called as the teratogenic. Okay, so the effect which are coming like phacomelia, neural tube defect because of this teratogen, that is what we call the teratogenic effect. Okay, clear, bachcha? So the simple is, the question is like, what is the most teratogenic period? That is the most teratogenic period is the embryonic phase is the most teratogenic period. Okay, so among these fertilized ovum period or the embryonic period or the fetal stage. Okay, so which one is the most teratogenic period? Yes, that is the, yes, very nice. So most teratogenic period is the our embryonic period. Okay, clear. Okay, students, here is the next question in front of you all. Okay, do read the question perfectly. Okay, here is the next question. Okay, so in front of you all, do read the question perfectly till the end. So then give the try to give the best answer for this one. Okay, so at how many weeks can the fetal heart rate sound typically detected via ultrasonography? Okay, so when we have to listen the fetal heart sound. Okay, that is the fetal heart sound. So with the help of the ultrasound Doppler, when we can assess. Yes, students, the fetal heart sound we can assess with the help of the Doppler and we can help of the with the help of the fetoscope. Okay, fetoscope is used for assessing the fetal heart sound. Okay, then Doppler also we can use, but with the help of the Doppler we can assess it early in the age only. Okay, so for fetoscope we have to wait for the up till, yes, what week, that is the, yes, very nice of you all. Okay, so with the help of the fetoscope we have to wait for the till 18 to 20 weeks. Okay, so but with the help of the Doppler we can assess it the, yes, very nice, all of you have given the correct answer. At 12 week we can hear the fetal heart sound. Okay, we can hear the fetal heart sound with the help of the fetal heart sound we can hear with the help of the Doppler at the 10 week of the pregnancy. It is very basic and important. With the help of the fetoscope we have to wait till the 18 to 20 weeks. Okay, so the correct answer for this one is the our 10 weeks. Okay, fetal heart sound with the help of the Doppler. Okay, we can assess at the 10 week of the gestation. Okay, clear bachcho, clear. Okay, so 20 week is the 18 to 20 week, that is the, with the help of the fetoscope we can assess the fetal heart sound. But the question it will comes like this. Okay, so consider this one. So when we have to see the cardiac movement. Okay, so when we will see the cardiac movement. Okay, so now I am asking the question related to the cardiac movement or the cardiac activity. This question is not related to the fetal heart sound. Okay, this is not related to the fetal heart sound. So cardiac movement or the cardiac activity means we have to see on the, yes, 21 day after fertilization. Okay, after fertilization, or we can say 3 week after fertilization. Okay, after the fertilization, then one more question it will comes like with the respect to the gestational age. Okay, so we can say that is the 5 week of period of gestation. Okay, so 5 week of the period of gestation. So why the difference is like this, students? What I told here, cardiac movement we can assess early. Okay, so that is the cardiac movement after the 21 day after fertilization or 3 week after fertilization. So this is in respect to fertilization. So fifth week of the period of gestation, this is in respect to the period of gestation. Students, you have to understand the basic, so then you will be understanding what is the period of gestation or the, yes, the fertilization period. Okay, consider, so whenever we are telling the period of gestation, this is the, yes, 0 to 28 days cycle. Okay, so on the 14th day the ovulation will occur. Okay, so on the 14th day ovulation will occur means the 14th day ova will get releases. Okay, so on the same day the sperm will comes, the sperm and plus ova will meet together. Okay, the fertilization will occur. Okay, the fertilization, what is the fertilization? The fertilization is the process of fusion of the sperm and ova, that is the fertilization. Means we can say the date of the ovulation is equal to date of the fertilization, means the fertilization occurs on the 14th day. Okay, then so this is what you call, if the now the fetus is like on the 28th day or the missed period means, so this is called the 2 week fetus. Now the fetal age is the 2 week. So when we have to come for the gestational age, we will consider the gestational age as the first day of last menstrual period. Okay, so we'll consider the gestational age from the first day. Okay, from the first day of the last menstrual period to till the date. Okay, to till the date. So now if the fetal age is 2 week means, if the fetal age is 2 week means the period of pregnancy or the gestational age is 4 week. So how means, so the gestational age we are considering from the first day of the last menstrual period, or the fetal age we are considering from the day of the fertilization. Okay, so this is the very important and two basic formula you have to understand related to the, yes, the gestational age and fetal age. Sometime the question will give like this, the fetal age of the 3 weeks, the fetus is age of the 3 weeks. So then what is the gestational age? Okay, what is the period of gestational or the gestational age? The questions will comes like this. Okay, if they will ask the questions like this. Okay, so the gestational age is equal to fetal age plus 2 week. We have to give the answer. Okay, so fetal age they have given the 3 week, then add the 2 weeks, so the answer will be 5 week. Okay, so if in case, yes, they have given the gestational age. Okay, so like the gestational age is 8 week. The gestational age is 8 week. So they want you to identify the fetal age. Okay. So whenever they will give the the gestational age and they are asking for the fetal age means, so you have to write the fetal age is equal to gestational age minus 2 week. Okay. So this is the very basic. Then now the gestational age they have given the 8 week. 8 week minus 2 weeks is equal to 6 week. So this is what the difference between the fertilization period or the fetal age and gestational age. Okay. So always fetal age is the 2 week less than the gestational age, and always gestational age is the 2 week more than the fetal age. Why? Because the gestational age we are considering from the first day of the last menstrual period, and the fetal age we are considering from the day of the ovulation. Clear, bachcho? Clear? This concept is clear. Very nice of you all. Okay. So this is the what the effect of the conceptual study. So that is what here I told. The cardiac movement we can see the third week of the fertilization means. Okay, so it is fifth week of the period of gestation. Clear? So in the questions they can give the both. Okay, third week of the fertilization. Option B, yes, they will give the question like when we will see the cardiac movement of the fetus. Option A is the third week of the fertilization. Option B is the fifth week of the period of gestation. Option C, any other option. Then in option D they will give both A and B. So the answer both A and B is correct, because with respect to the period of gestation, fifth week. With respect to the fertilization, it is 3 week is the correct answer, we can say. Okay, students, don't confuse between the fetal heart sound and the cardiac movement. Fetal heart sound means we are seeing the sound. Okay, so in the cardiac movement, with the help of the ultrasonography, we are checking that there is movement of the heart is there or not. Okay, so yes, is this clear? Clear. Okay, fetal heart rate, fetal heart sound means yes, early with the help of the Doppler we can assess on the 10th week. Okay, with the help of the fetoscope we can assess on the 20th week. Okay, but the cardiac movement early we can assess in the 21st after the 21st after the period of gestation. Then 21 day after the period of fertilization, or the 3 week after the period of fertilization, or the 5th week of the period of gestation. So this is the today's concept which will help you for solving the many questions in your upcoming exams without any confusion. I think so. If you have any doubts, you can clear your doubt in the comment section. Okay. Yes. So this is a very basic and important class for you all. So if you want the more content like this, so do comment in the comment box. Okay. So stay tuned with the master nursing classes. Join our Telegram group. So that will help you all. Okay. So timing is changed now. So today onwards the classes will be evening only. Okay. So no morning classes. Evening will be there your classes. Okay. Students, clear? So if any changes in the timings, we will update in our Telegram group. You can join the Telegram group also. Okay. So hope the concepts are clear today. So if you have any found any doubts, so do comment in the comment box. We will discuss that one in the next session. So okay. So pedigree also I will discuss in the next session. Students, don't worry. Yes, I will take this concept. Okay, that is there in my plan. So it is like 3 to 4 more classes. Okay, in the 5th class I think so the pedigree will come. So don't worry, I will discuss that one before your exams. Okay, clear? Yes, very nice of you all. So we'll meet again in the next class. Tab tak ke liye Jai Hind, Jai Bharat.